Now, live with Greg Olson, Director of the New York State Office for the Aging.
Well, hello and welcome. My name is Roger Noyes. I'm Director of Public Information here at Nice Sofa. I'm filling in for Greg today, who regrets he's unable to attend today's live stream, but just wanted to share with you that this is the topic we're discussing today is something of extreme importance to him and to our network. In fact, we have a quote here on the screen that is part of an announcement that's going out today that we're excited to kind of deliver some breaking news. We'll deliver that a little bit later in the program, but I just wanted to share this quote from Greg in recognition of today's topic and the discussion we're going to have. So today is National HIV, AIDS, and Aging Awareness Day. And so the question is, why is this day so important? We'll talk a little bit about the meaning of the day and its origins, but it's important to emphasize that anyone can get HIV, right, including older people. And we need to emphasize that fact and understand that fact. And according to the CDC, in 2021, roughly 41% of the people in the United States with HIV were at least 55 years old. Secondly, while many HIV risk factors are the same for people of any age, older people are less likely to get tested for HIV. And we'll talk about some of the reasons behind that and some of the factors. And then thirdly, older people living with HIV may experience the double effect of an HIV diagnosis, but also ageism and other stigmas that occur in the community. So we are going to delve into all those issues. I don't want to take too much of our guest's thunder because he has a lot to say about this topic. So we are very delighted to have John Hartigan with us today. He is the HIV and Aging Project Director at the New York State Department of Health. And he is also going to tell us a little bit about some of the programs to help older New Yorkers and their caregivers related to HIV and AIDS. It looks like there's John. Hey, John, how are you?
I'm good. How are you doing?
Well, welcome to today's program. Thanks
Great to be here with you, Roger. Thank you. Great to be here with you, Roger.
So if you're watching today's program on YouTube, please subscribe to our channel and all of our social media channels. And I just want to, welcome John and have to just start off. Tell us about your role at the Department of Health and what led you to this important work that you do in this space.
Absolutely. It's great to be with you, Roger, here today. And I give Greg my best. We emailed earlier this week, and I look forward to having chats with him in the future. I've known him for a few years. I know he's very dedicated to this as well as John Cochran. So my role is HIV and Aging Project Director at the AIDS Institute. For those of you that are not familiar with the AIDS Institute, we are part of the New York State Department of Health, and we oversee a bunch of different things, including HIV, hepatitis C, drug user health, LGBTQ health. So it's a very large organization. It started back in the 80s as an HIV kind of overseer for the state, but it's really developed over the decades. A few years ago, we identified, a number of years ago, that the HIV population is aging, and we really felt like we needed to put some real intentional focus onto that. So the position that I'm currently in was created, and I'm very fortunate to be in it. And how I got here, I've been working in the field of HIV for 35 years, since 1991. Started as an MSW student here in Albany, New York. It's kind of a long story, but I'll keep it really short, Roger. I mean, basically, I was introduced to a young man who was dying of AIDS at that point in 1991 by a friend of mine. Because I was kind of interested in HIV. I didn't know an awful lot about it back then. That's when things were really bad with HIV. And a lot of people were very, very sick because it was before medications had advanced. And I went up to the AIDS unit and met this person, and I was just struck by his compassion and his courage and strength. And he died 2 weeks later. And I decided at that moment that this is what I needed to do for the rest of my life. So I'm getting a little choked up because it's such an important thing for me. It's been 35 years of my life. So I became a hospital social worker in the field of HIV, and then worked in a bunch of different capacities, and then went on to do some other social work stuff and therapy, and working a lot around, in the field of HIV and mental health and substance use, and then made my way back to Albany Med as director of client services, and then went to the AIDS Institute about 22 years ago and oversaw client services at ADAP program, and now I'm working division of HIV hepatitis healthcare. So a lot of work around HIV. And the other important thing I just want to say too is as a personal connection. I've known a lot of people that have been living with HIV for my entire adult life. And 22 years ago, I myself was diagnosed with HIV. So I'm also aging with HIV in addition to working in the field. So I was doing the work and then found out I was HIV positive myself. So very personal connection, and I'm very passionate about the work that I'm doing.
Well, and thanks for sharing that, because, as we know, you can have the technical background, you can have the training, but if you come from a personal experience, um, and the many things, areas that you just described that were personal to you, you go at it with a purpose and a commitment that's unparalleled. So thank you for sharing that with us.
Absolutely. Yeah. And I know
Um,
it's interesting, Roger, too, is that like I even felt a little anxiety just even saying that today. And I think that just speaks to still, after 35 years, the stigma that we have around HIV. I'm sure we'll be talking a lot about that. But it's a decision that people sometimes need to make, whether they disclose or not, still, even after so many years. It is an honor, though, to be talking about it with you.
no, thank you. Well, tell us about the day. I'm sure it has special meaning to you, but also in your profession, also personally and professionally. It's HIV/AIDS and Aging Awareness Day. I'm so grateful that there's that connection that's been made, and a recognition that that type of connection needs to be emphasized. So tell us about the day. What are we here to commemorate? What's the origin? If you have a little information about the origin of it.
Yeah, it started a number of years ago. It's always September 18th, which is today. And as we know, there's a lot of awareness days, for almost everything, and especially in public health. It's almost every other day there's an awareness day. But today specifically, it became a national recognition day, and it's observed to focus really on the increasing number of people who are living long, full lives, much due to, the real major advancements that we've made in HIV treatment over the years. So many more people are living, um, into their 90s. I've actually had two patients that I'm aware of that are in their 90s living with HIV.
Huh.
So I think that this day really calls attention to, the unique health and social needs that people have, and the challenges that we have, around HIV prevention and testing, and so with treatment, and just, I guess, care for people who are aging, who also are HIV positive. So that's really what this day is about, to reflect on that, and and also just a lot of gratitude for all the you know the medical people, medical clinicians and doctors and nurses who have helped people for so long, and for obviously the people themselves who have gone through so much, like myself, who have been living with HIV, and we talk about long-term survivors, people who have been living with HIV for over 15 years. And you can see from this graphic here that people, um, the projections are, over the next decade or so, more and more folks living with HIV are going to be in the higher age brackets.
Mhm.
And I also want to call out attention to lifetime survivors, people who are not over 50, but people who were perinatally infected with HIV. And a lot of those individuals are in their 30s and up to late 30s, early 40s at this point, some of them, and are also aging with HIV. So this day is about them as well. This graphic I can just actually talk a little bit about. This is, if people are interested in the number of people in New York State who are HIV positive. Um, we our surveillance data is always a year or two back. With any kind of public health or in any realm, data is always a little lagged. But as of 2023, we had 105,000, over under 5,000 people living with diagnosed HIV. I think that's a really important point too, Roger, is that this is diagnosed means people who have tested positive for HIV. And we'll probably talk about this later, but there's a lot of people who are living with HIV who don't know it,
Yeah.
especially folks that are aging, and we'll talk about that. But for those that are diagnosed, this is just a quick breakout of demographics, and we see male and female. The slides are a little funky; you can't really see some of the descriptors, but HIV definitely disproportionately impacts people of color. If you go back to the previous slide, you could see Hispanic and African American, Black, about 2/3 of the people with diagnosed HIV. And then, how people contracted HIV back in the 80s and early 90s, folks, we really thought of HIV as a male-to-male disease, a gay disease, and now we know that people who are being infected is really everybody, anyone who might be at risk, who might be having sexual contact. Drug user health, fortunately, we've done a lot of great work around drug use, injection drug use. So that's really kind of on the low scale of people that are infected with HIV that way. But we're human beings, and if you think about HIV, the first letter is H, human, and we're all human sexual beings, and HIV can be contracted um, by anyone who's sexually active.
I think it might merit just kind of taking a step back too, and also I think people might not know the difference or may not remember the difference, right, between HIV and AIDS, and also, and correct me if I don't have this quite right, but do people mistakenly interchange them? And can you speak to that and just sort of talk about the differences?
Yeah, it's a really interesting topic, actually. Well, historically, HIV and AIDS weren't even the first word that we identified back in, I think it was 1983, back in San Francisco and then in New York City. The gay male population were dying of this unknown immune deficiency disorder. And people were getting very sick with really serious illnesses, things that people didn't, the medical community hadn't seen, with different kinds of cancers and pneumonias. So, some of the folks that might be watching this may remember seeing, movies about HIV and AIDS, like Philadelphia that came out, I think, in the 90s,
Yeah.
and other films. But HIV is basically, after about a year and after a lot of advocacy was done, the name of HIV was changed from GRID, which was just related to gay men, because we then quickly realized that HIV spread to the entire community of human beings. Um, and HIV is basically when someone is infected with HIV, it's the human immunodeficiency virus. It's a virus that enters the body. And if you're HIV positive, it means that you have just been infected with HIV. And typically, the course is someone's infected, they go through a seroconversion, and then may get sick or may not initially. And then after many, many years, if untreated, or a few years, they will start having complications, medical complications, and that's when someone kind of transitions to AIDS. I won't get into all the medical aspects, but it has to do with the amount of virus in the body, which is called a viral load. The body fights off viruses with like white blood cells or CD4 cells, and if those go real low, someone can kind of transition to AIDS. The really great thing is that with all the advances in medications, people now, when someone is diagnosed HIV, we immediately start someone on treatment. And there was a lot of controversy about that 20 years ago, about when do you start the medications,
Mhm.
because they might be toxic, they may hurt people. But we know now that someone should get right onto treatment and suppress the virus. So we hear about viral load suppression, which basically means that someone's HIV is at a very low level. And we know that someone can't transmit HIV if they're undetectable, which is another prevention issue that we'll talk about. But basically, the difference is that HIV is just when someone's living with HIV, someone has AIDS, if they have a lot of medical issues related to HIV and their immune system has been compromised. And so a lot of long-term survivors, I was fortunate 22 years ago that I started writing medication and I didn't go into AIDS, but there are a lot of long-term survivors who now are considered to have AIDS.
Mm.
But I think in the community, we just say people are HIV positive or not. I think a lot of people who have gotten to the point where they've been diagnosed with AIDS, it's almost of a it's a double-edged sword because there's so much stigma around AIDS, because it was such a difficult time in our history and for so many reasons, biologically, medically, politically. There's a lot to it. Um, but I think a lot of long-term survivors still want to say, I have AIDS and I've had AIDS for 30 years. It's almost like a badge of honor. I've
Yeah.
lived with this for such a long time and have gone through hell with it. So a kind of long answer to an easy question,
No,
but it wasn't
no,
really,
no.
it wasn't a simple question,
We'll also give a lot of that background. I was kind of struck when we talked earlier. It sounds like, just your work, but also the Department of Health has really been since the beginning, right? Like it sounds like pretty right out of the gate, recognizing maybe before other states give you a chance to plug that foresight. But so that history is important.
Yeah, I'm really proud to be in New York State for so many reasons right now. But it's certainly part of the New York State Department of Health because basically when HIV was started, in 1983, that's when the AIDS Institute was founded by Dr. Nicholas Rango, who himself was HIV positive and died of AIDS a few years after. An amazing physician with great foresight and passion, and really got us going, and we've had amazing medical directors ever since. And we now have like 400 or 500 employees that address the needs of people living and aging with HIV prevention. And as I said, so many other aspects. We call syndemics. We know all kinds of different things that people could be struggling with: hepatitis C, drug user health, LGBTQ community, all things that are related to HIV, but also separate. So the Institute is really developed, but we really were at the forefront. And I think nationally, we're kind of looked to for information and for the work that we've done because we've been very lucky to really be at the forefront. And also the incidence of HIV is pretty high in New York State, as I mentioned. 104,000 is a lot. It's a lot more because there's undiagnosed HIV. A lot done in New York City, and certainly rest of the state. But we kind of have been one of the epicenters with some of the other larger states.
Previously, we had a slide on HIV in older adults. Alex, if you could go back, thank you, perfect. Because I want to talk about some of these things and kind of spend a little bit more time delving into them, because there's really important intersectional things, right? From aging and HIV diagnosis, these are some of those things. But if we could just pause and talk a little bit about these, John, and just tell us what are some of the unique issues and concerns of people facing HIV diagnosis, but also, maybe even looking at it from, outside of receiving a diagnosis and learning of a diagnosis, just the perceptions that maybe older people might have, or, because they remember a different time during
Yeah.
during the sort of history of this illness. So, kind of talk a little bit about some of those issues we just saw.
Sure, absolutely. So as I've said, HIV has really been around for 40 years. So the slide that you just showed, has a couple images around stigma and ACT UP, and fighting for our lives. So back in the 80s and 90s, you know, HIV, it was really very difficult conversations that were happening because treatment wasn't available. The community really stood up for themselves, and it was primarily at that point the LGBTQ community, but then a lot of people jumped on the bandwagon and ACT UP basically was an advocacy organization that changed the course of this medical condition, and was the reason why now we have medications that have saved so many lives. But it took a long time. It took decades. I mean, it took basically until 1996, so about 13 years before we had medications that could really help prolong lives and you could kind of curtail people from dying. So it took a while. What you have here on the screen too is just, the people that are really the long-term survivors have been living with HIV for decades and decades will remember the very difficult time, of when their friends were dying, and losing. I mean, I remember back in the 90s, being in the gay community, hearing of different people and having friends who were getting sick and dying. And that's traumatic. It's traumatic for community. It's traumatic for anyone. There's a sense now of survivor's guilt for people that maybe are still living with HIV after 30 or 40 years, but their friends have gone, and it's the question of, well, why me? Why am I still alive? Um, I think, again, we talked a little bit about stigma. It still exists. There's still a lot of lack of knowledge, lack of understanding. I think HIV is still um, identified with certain communities of people, whether it's the LGBT community or, again, disproportionately impacts people of color. So people think, lower economic background maybe, or other issues, kind of socioeconomic issues, and there's some judgment, and unfortunately, and that has gotten better, and I think there's waves of stigma and lack of understanding and knowledge in our history. Um, uh, People, because of long-term surviving and going through really battle and war, and I really did feel like a war even before I was diagnosed, being on an HIV unit and coming back after a weekend and 4 patients had died. I mean, I was only 24 years old. It was horrible. It was horrible. And people, um, bring with that bring that with them, through a sense of trauma. There's high rates of depression and anxiety with people living and aging with HIV for so many reasons. We know that social determinants of health, and we'll probably address this later, but really impact health outcomes and how people are taking care of themselves. So whether it's transportation or nutrition or any of these things, they impact. But mental health is
Yeah.
a big social determinant of health, and for people are have a 5 times higher rate of depression, or I think it's 2 times higher rate of anxiety, living with HIV. That's going to have a great impact.
What's
Um,
great about this conversation is all the things you just said just really speaks to what we do in the aging services system. I mean, it's social determinants of health and the intersection of health and your environment and all these things. And I was struck by some of the bullets. Social isolation is something that we concentrate on at the Office for the Aging. It's a big area of focus for us, but it takes on a very new dimension when you intersect that with survivor's guilt at the same time, and some of these overlapping concerns. So it was just really powerful to sort of see that and think about that in our own work and how you're a part of it, right? What you guys are doing. So
I think there's just so many connections, and I think that's one of the reasons I'm so glad we're talking, is having this conversation with a larger aging community, because there's just so many interactions and intersections. And I think about isolation and loneliness, and I'm sure again we'll probably address this later, but um, you know, we all experience isolation and loneliness during COVID, so everyone knows what it feels like. But someone who is older and potentially have been disenfranchised from their family because they're part of the LGBTQ
right.
community, or for whatever reason, um, and has lost many friends, and may not have children, and it may have a small circle. For so many reasons, may feel very isolated. And then on top of that, the stigma of HIV, and then on top of that, getting older and dealing with all the medical aspects of getting older, and probably at a little bit at an earlier age. And we can talk about that aspect of things. So things kind of just layer on top of each other and have such a dramatic impact on folks. But
Yeah.
isolation and loneliness, I know I've talked to Greg about this. It's huge. I mean, something
Yeah.
that you guys are addressing constantly through NISOFA with all of your interventions and things that you're working across the state.
Yeah. So we have, I think I mentioned this earlier. So we have some exciting news today, breaking news. So I was going to ask you about some specific resources for older adults that are available. But so we're here on the 18th, right? People might, September 18th. Some people might be seeing this broadcast at another time, but today is HIV/AIDS and Aging Awareness Day. And on this day, the Department of Health has announced what's the new resource that's out today?
Yeah, it's great. It's great. So we've been working on a web page, and web pages are not always easy to get going. But here's on the screen an infographic, and this just gives a few of the stats that we talked a little bit about. But actually, I probably should talk a little bit more about some of these things. But this is a QR code and the actual web address for our website. And our website is pretty substantial. It's got a lot of information about what we're doing to address HIV and aging. It has a lot of resources. It has information about the work of you're doing at NISOFA with aging. So it's kind of bringing all of the different pieces together. And I'm very excited about it. It's kind of been a work of love for many, many months. And it's going live today, which was just amazing timing. So great thanks to the Department of Health and our public affairs group for making this happen. And it takes a village, so it's
Yeah.
wonderful to get things going and get information out there to folks. So it's going to be a great resource for people to go to get more information about aging and HIV.
And I just want to point out that should be in the chat, that link. We're going to be promoting it in our newsletter and wherever else. So it's really important for people, to see it, but also share it. Send it to someone that you think would need this information. Not only someone who may be diagnosed with HIV, but also a caregiver, right? Or someone who knows somebody, right? Just get the word out. And there's a wealth of resources. And it was nice to be able to get a sneak preview of it. So thank you for letting me see initial drafts. There's a lot of information on there. You had just said you want to kind of speak again. I know we talked a little bit on the statistics, and we had some on the screen, but when we put that infographic up, it sounded like you want to frame that a little bit more, delve into that a little bit more. You tell us a little bit more about prevalence in this population. So
it just really prompted a few thoughts. 56% of people with diagnosed HIV are over 50. I kind of missed that earlier because we were talking about a lot of different things. And that's a large number if you think about it. I mean, that's more than half, and that's just going to grow. And then, we have some stats now that through our surveillance that people over 60, that's just trending upward in terms of the number of people aging with HIV. And then years diagnosed. I think I mentioned this, that we had two patients that are in one of a program that I'll talk about that are over 90. But there's a little graphic here about the number of years living with HIV. And so there's a great number of people who've been living with HIV more than 20 or 30 years. I think another thing that we didn't talk too much about, and maybe we can talk about, it's not necessarily in this graphic, but we'll talk about the pilot, I think, in our next segment.
A little bit later, yeah.
But
well, actually,
go ahead.
Go ahead. No, you go ahead. Go ahead.
I think some of the unique issues, and we touched on some of the psychosocial issues, but I think I just want to talk a little bit about the medical issues. I'm not a medical provider or clinician, but I've been in the field for so long. I think it is really important for people to understand that when people are aging with HIV, have been living with HIV for 20, 30 years or longer, there's a medical thing that's happening that's very different and unique for them. I think it might be the next slide. There you go. So we call it multi-morbidity. Nice job. Look at that. Alex is great.
Alex is a pro. Alex Hyatt and Darren Boyson are our communications team. And I just want to give a shout out to them behind the scenes, making all the magic happen. So thanks.
Yeah, go guys. That's good job. That was really great. So folks that are aging with HIV could be more prone to getting, I'm not going to go through each one of these, but a bunch of comorbidities or like secondary illnesses and things that you can see they're very serious. I mean, things, cancer and liver disease and osteoporosis. So someone, that might be, working with NISOFA who's not HIV positive might get a bone density scan, at 60 or 70 years old. And, our bones get, we develop frailty as we get older. I mean, that's what you guys all know, and probably anyone that's listening today might be experiencing or working with people who are experiencing. But people who are HIV positive, the virus is in the body, even if it's undetectable, there is something called inflammation. And inflammation basically is a body reaction to HIV, and that doesn't go away. So in a nutshell, people that are aging with HIV can appear to be 10 or 15 years older in terms of their kind of biology and what they might be prone to in terms of medical illnesses. So someone like myself who's almost 60 might have medical issues that I wouldn't see, until I was 75 maybe. And it's
Mhm.
due to a lot of different things we don't have time to get into. It could be, previous medications. It could be the inflammation. It could be the actual virus itself. There's a lot of, research being done right now to kind of figure that out. And again, we've come an incredibly long way. But people aging with HIV are struggling not just with HIV and stigma and all the psychosocial issues, but a lot of medical issues as well. So it's again layered. It's very complicated and complex. And I think the HIV community, now as they age, need a lot more support, and from the medical community at large, but also socially. And that's one of the reasons that we're working with you guys, and we're going to get into that as well.
No, I'm glad you brought in the medical, because we were talking quite a bit about the social and psychological. So that's really important. So we're going to take a quick break. If you're just joining us, we're with John Hartigan, who is the HIV and Aging Project Director at the New York State Department of Health. And we've been talking about some resources for older adults and sexual health. And one of those resources is pretty exciting, is a video series. John, was this developed by DOH or in partnership?
It was, and it is. We have an education and training department within the AIDS Institute, and one of the things that we haven't talked too much about prevention yet, and I think we need to talk a lot about prevention.
Mhm.
But I think the videos that you're going to see are being launched as part of PrEP Aware Week. So, Roger, do you want me to talk a little bit about prevention before we go to the videos, or do you want to show the videos first?
Why don't we show the video real quick, and then maybe we could talk about it. So
The
we'll
other
take
side?
a quick
Okay.
break. This is about PrEP. It's a medicine for HIV negative individuals at risk. So, but it features an older adult, and let's take a look.
My name is Jeff Weinstein. Medicare is my primary way of paying for PrEP. It's one way an older person can show that it's important to have sex, to be cared for, and to get good sexual health care. And PrEP is part of that health care. It's important to me to be a PrEP ambassador so I can help, especially help older people understand why we need PrEP to have sex healthfully and in a way that we can also afford. PrEP revolution.
I'd like for people to know that as a person of faith, a leader in a faith community, that we are in positions where we can speak up and break down stigma. My name is Bishop Tony Green. We have so many things available to keep people healthier, especially now that we have PrEP. It's very important to show up right now because I feel that there's a lot of pushback on our community and communities that can benefit from PrEP. Many may have barriers that is preventing them from receiving what they need to stay healthy. And those of us that are in positions where we can help break down those barriers, it's more important than ever for us to speak up. PrEP is revolutionary.
Those are great segments. So that kind of led us to the conversation about prevention. So maybe let's go there, which I don't. We haven't addressed yet. So talk to us about, and maybe take it from the perspective of what you're doing and why prevention is so important in the aging community.
Absolutely. So, as I kind of alluded to, HIV can impact anyone. We know statistically that roughly between 15 and 20% of folks diagnosed with HIV are over 50, which is actually kind of an alarming number. And I think people might be surprised to hear that, because when we think about HIV diagnosis, I think historically we think about, people that are younger, 20s and 30s, and if almost 20% of people are over 50, that's significant. And I think that speaks to the fact that older people are having sex, and we don't always talk about that or are comfortable talking about that. And the other interesting statistic is that about half of the people that are diagnosed with HIV over 50 have concurrent illness, which means that they've been living with HIV for quite a while. Which is kind of scary these days because we've over the decades talked about HIV testing so much and the importance of it. But I think I think there's certain communities of people that don't necessarily think that they're at risk. I was talking to my doctor 6 months ago, who, when I went in, I said, "So how many older folks are you seeing diagnosed?" He goes, "John, we had another one," and it was, an African American Black woman who was 60 years old, who her husband died. And she started dating again and didn't think about using condoms because she knew she couldn't get pregnant,
Mhm.
and didn't have the conversation. And here she is HIV positive and has a couple other STIs as well. So I think
Yeah.
it's so important that we talk about sexuality and healthy sexuality and bolster those efforts, but also certainly in terms of prevention around HIV, we have so many tools at our disposal now. We have um, HIV testing was a lot more onerous in years past. Now HIV tests, you can actually get them at the drugstore, and you can get them through a free website that we'll be posting later through the Department of Health, and you can actually get your results at home in the privacy of your own home.
Mhm.
PrEP it's been around for a while, but not everyone knows about it, which is interesting. I think as much as we do advertising and promotion of PrEP, PrEP is pre-exposure prophylaxis. And basically, as you said, Roger, it's taking a pill a day if you think you might be at risk for HIV, and it basically prevents someone from acquiring HIV. It's very effective. And now we have PrEP that are actually, if someone's really at risk, if they're in a relationship with someone who's HIV positive, or if they're dating a lot, or in a community where they might be at risk, you can get injectable PrEP. Every 2 months you can get an injection, and now there's a brand new one that's every 6 months. So you can literally get a shot like a vaccine. It's not a vaccine because we don't have HIV vaccine yet, but you can get an injection for PrEP. Um, and it's been FDA approved, and now it's paid for by Medicare, as you saw in the video. So it's amazing.
That's
So
an
this,
important point to emphasize too, right? Like, talk to your physician, because I'm sure there's issue. I like the example you gave of talking to your physician. It sounds like your physician is very attuned, and hopefully more physicians are to ask questions, because there's the ageist lens, right? Talking to an older adult and not bringing up the conversation of sexuality, which we're all sexual beings, right? Like, it's something that we can all discuss and talk about, and we should be able to talk about it freely and openly. And those conversations are important, to not dismiss the fact that someone might need this information to help prevent themselves from acquiring an illness, or also just to stay safe, right? So that's
it's so important. I really want to emphasize too, because this will help with in the HIV community, at the Eames Institute, and in our circle. We're talking about this every day, and we're researching, and we're doing outreach and all these things. And we think everyone knows what U equals U means, but people don't. So U equals U. I think I mentioned this earlier, but it means undetectable equals untransmittable. So basically, that means that someone who's HIV positive, if they're taking medications and their viral load is suppressed, they cannot transmit it to someone else. So that's another means of prevention that we have at our disposal, which is just amazing. So it's so important in the medical realm that anyone who has HIV is virally suppressed. So that's one of the huge goals of the AIDS Institute, and actually the national ending the epidemic standards is that the highest percentage that we can get of people that are virally suppressed, because that will actually prevent HIV from spreading.
Mhm.
So we really need to get people into treatment and get them retained and to stay in treatment, but also get the messages out there about PrEP and about still using condoms. And a lot of older people don't want to use condoms. They didn't use them, and are comfortable with them. Um, and there's issues, we won't get into all the details, but even erectile dysfunction. Some people don't want to use condoms because they can't. If someone's in their 70s or early 80s, could still be sexually active, but so we could probably talk about this for 2 hours, Roger, but I think
Yeah.
that.
I also want to remind people, we're putting a lot of information in the chat too. So there's resource guides, information about PrEP. There's some social media campaign messaging that is kind of in this realm of prevention and sexual health and things that we've been talking about. So just want to encourage people to to as you're listening today to grab those resources, look at them later, whenever, and share them with people. And again, to remind people about the newly launched website that's available through the Department of Health to direct people to resources for HIV and aging information. So let's talk a little bit more about like some of the work we've been doing together. So I know that we've worked with the New York Connects and surveyed area agencies on aging and independent living centers. What responses have you gotten from that interaction? What kind of questions have you asked? What has been the reason for it, and what the results have been, and what are we going to do with that information?
Absolutely. It's a great question. So, and I'm realizing there's so many things that we haven't talked about. And I think I want to just start that by, it kind of originated because a couple of years ago, we started what's called the People Aging with HIV pilot. So we have a specific grant here in New York State that pays for 10 different sites to do HIV and aging specific work. So they're in every single region of the state. So if you have listeners that are in Buffalo or Central New York or down in New York City, we have HIV and aging sites. It doesn't serve everybody, but it serves some of the community. In doing that work and really tailoring our services to some of the things that we talked about, like the comorbidities and the social aspects of HIV and aging, we realized that the HIV medical providers and even the HIV social service providers can't do it all. I know, because there's such a high number of people aging with HIV, and there's so much prevention work that we need to do. So, I partnered with you guys. So, Greg and John and folks at NYSOFA, it's have been wonderfully supportive and collaborative, because I'm sure your listeners are very familiar with New York Connects, which is your network of aging providers across the state, and the New York Connects website that has all of the resources, everything you would want for aging and for caregivers. And so we made it a really concerted effort to work together so that we could, first kind of increase the knowledge base of both HIV providers about the aging services that are available through New York State, but then vice versa, so that we could help the aging providers in every county of the state learn a little bit more about HIV. So we did a little HIV 101, some of the information that we're talking about today, and then introduce them to the providers in their areas so they could team up and work together. So a lot of wonderful things have been happening. We've had, some of the HIV providers tabling at aging events. We've been having, there's a lot of some sharing of resources. We developed a number of years ago with collaboration with NYSOFA. We developed a sexual health guide. We've been kind of re-promoting that, and we're even trying to develop a new resource around sexual health that's like a digital resource that people will have access to, and just because we're all in this together, and we need the aging service providers to really understand the impact of HIV, and we need to learn from you guys as well, because you have done such amazing work throughout the state with folks that are aging, and we want to tap into those resources. So it's been really a wonderful kind of endeavor. Some of the challenges have just been, lack of knowledge. We found that, people just didn't understand or have the knowledge base. Again, we live in this HIV, well, I do, and the people in the agency live in this HIV world, and we just assumed everyone knows everything. And then in the broader world, in the Asian community, people are still kind of thinking about HIV back, in the 90s, and they might know that there's medications and the people, Magic Johnson's still alive and things like that, but you don't necessarily know a lot of the information that I've shared today. So we really
that's why this conversation is so important. I just want to highlight Beth Stranges from Chemung County put a little comment there that we flashed. Sounds like she's been doing some great work in the in her county on sexual health. So the sexual health task force. Yeah. So thanks for putting that up there, Alex.
It's so important.
Yeah. So the state's master plan for aging just recently came out. There's over 100 proposals that our agency and the Department of Health have been working closely on sort of shepherding this process. But these proposals are really the people's proposals, right? They've come to us through stakeholders, but also with the involvement of state agencies and community engagement sessions. I mean, there's been a lot of people have provided input into this process, so that's really important to highlight. So please take a look at the Master Plan for Aging website to see all those proposals. However, there are a couple that I know the AIDS Institute has worked closely on. And John, if you can just sort of summarize those really quickly or highlight what some of those proposals are and why they're important.
Yeah, absolutely. I think we've been talking about some of them, so it's a great kind of segue into this work. I've been really honored to be part of the master plan planning process. And as you said, Roger, it's been a huge endeavor, and there's hundreds and hundreds of people have been involved with this, and there's so many recommendations. There's so much work to be done around aging. We know that the aging population in New York State is just growing. So it's a master plan is absolutely needed. There's so many areas that need to be addressed. But we really did want to highlight some of the things related to HIV and sexual health. So one of them was an anti-stigma and education campaign. So we actually have a recommendation in there that we have a very formal anti-stigma education campaign. And part of that is just things like this, like these conversations that we're having to help people, understand about HIV and STIs, sexually transmitted infections, and the just the importance of reducing stigma and it still exists, unfortunately, and we need to really combat that because it's not helping anyone. The golden rule is for us to everyone's supposed to love each other, and unfortunately that's not always the case. So I think part of it is that campaign. Secondly, we know because of stigma that when people, whether they're in the LGBTQ community and or are HIV positive, when they go into long-term care facilities or nursing homes, there are some issues. There's some stigma issues, there's some discrimination issues. There's also an issue around access to like medications, and this goes beyond HIV. If someone's on, really expensive cancer medications, or someone's HIV positive and is on, a certain HIV regimen, going into a long-term care facility or a rehab or a nursing home sometimes can be a nightmare because, medications have changed. There's issues around, the payment of those medications, and it gets very complicated, way beyond the scope of this conversation. But we actually have a recommendation in the master plan around that to address the continuity of medical treatment and medication access. And then the third one is kind of what we were talking about before around sexual intimacy and to do some more training on sexual health and intimacy for older adults. I could talk about sex all day, and Roger and I, if we were out for lunch, we could probably talk about it, as it's you guys, and some people are very comfortable talking about sexuality and sex and what we need to do to help our old aging folks, but it's not a comfortable conversation for a lot, especially medical providers. Just kind of going back to the point we made earlier, Roger. My doctor I was referring to was an infectious disease doctor. If you go to a family practice doctor that you've been seeing for 30 years or any just general practitioner, very rarely are they asking about sexual practices. One, because there's a discomfort. Two, because there's not time. I mean, you go to the doctor, you have 10 or 15 minutes, maybe 20 minutes tops.
Right.
So we really want to promote training on how you talk about sexual health and intimacy. And again, I think in the resources that you're going to be putting out, there's a guide that we have. We're going to have an updated guide, but we really want to do some trainings to help service providers in the aging community to be able to have these conversations. And I was glad to see, in the comments that, this is happening. There are sexual health, task forces happening across the state. So it's not like no one's talking about it, but I think we need to make a really concerted effort as a state to be bolstering that issue and talking about it, because it's going to help people in many, many ways.
If you're just joining us, we're talking with John Hartigan of the AIDS Institute for HIV, AIDS, and Aging Awareness Day. If you're watching this on our YouTube channel, please subscribe. We're going to take a quick break and be right back with your questions. So watch this.
Hi, I'm Molly Ryan, and I'm a communications intern for the New York State Office for the Aging. I am so happy to be on board with this agency, and I'm for sure learning a lot. I have recently learned about the agency's YouTube channel, which has so many resources for older adults and their caregivers. There's a reason they have millions of views. Like and subscribe today.
Shout out to Molly. She was one of our communications interns who I have a feeling you're going to see on TV news at some point because that's what her area of study was. So we're just going to get to some questions from the audience if we have any. So yeah, John, can you talk about HIV testing? What options are available?
Sure. I mentioned this a little bit earlier, but you know, there's many options. There is, if you go to your doctor, you can get a test. If you go to a clinic, if you go to a hospital, testing is done pretty much anywhere. You can go to, if there's a privacy concern, you can go to your local health department, and HIV and STI tests are available. And there's HIV is still um, very much protected. The confidentiality law, especially in New York State, is called Article 27F, is very, very strict. So if people are concerned about privacy, there's still a lot of things in place to keep people's privacy. People now can take an HIV test at home. You can buy one at CVS, and some of them were sent out, and some of them were, now we have rapid tests, so people can get the results right away. There's a program through New York State, which is the home test giveaway, which I think we'll have a link for that can be put in the chat, where you can order tests and have them sent to your home. So there's all kinds of options for testing.
And I think this sort of addressed in this other question, privacy being respected, right? I mean, there's so the good thing to know is there's options to, if you don't feel comfortable, right? There's options for self-testing as we described. But any other things you want to say about that, the issue of privacy?
Yeah, I mean, we talked a lot about stigma. I mean, it's still HIV. There's still a lot of stigma, and I think the one of the old slogans for ACT UP, which was is knowledge equals power, and I think we all need to be informed, and that's just so important. But stigma's there, and people still, if someone is concerned about getting tested or is diagnosed HIV. There's the issue of disclosure and who do you tell, and is my family going to still accept me or love me, and all those things 35, 40 years later still exist.
Right.
So but there are very strict privacy laws. I mentioned Article 27F, and anyone wants to look it up. We could spend a couple hours talking about the legal ramifications of HIV. But as scary and as sad as it is, in some states, there's criminalization laws on HIV. So if someone, even accidentally infects someone else, someone could still be put in jail. So that's not here in New York State, but there's still a lot of issues. So again, in New York State, we're very lucky to have very strict privacy laws and confidentiality laws, and someone can't disclose someone's HIV status without signed consent. There's some circumstances where they can, doctors can and stuff, but HIV confidentiality is very, very important. It's taken very seriously. So if someone, is concerned about, not getting tested because they don't want to know because they're afraid someone's going to find out, they should really allay that fear, and know that they can keep this private if they want to keep it private.
Looks like we have a question here. I see something about Darren from our team flashed it in the chat. Presenter, great life experience. Yep, thanks for sharing and your ongoing commitment. How do you see HIV needs in 2026? More funds for tests? What are the things that need to be done going forward? That's a great question.
Yeah, it's really a
probably a long answer, right? I don't know. There's probably a lot of things.
There's a lot of things I could say about this. I mean, we definitely need to sustain where we are right now. I think what I'm going to say is due to a lot of the things happening with the federal government right now and the impact that could make on public health. I'm sure a lot of your audience is aware that there's potential and very likely cuts to all kinds of Medicaid, and there's an assault actually on disease prevention, and we're concerned very much in the HIV community that we're not going to have funding for HIV prevention, which is scary because we have to do prevention to keep HIV at bay and to keep people healthy and safe. And there's a lot of messaging out there right now that vaccines aren't important, and I'm not sure how that's going to overstep into HIV at some point. In terms of treatment, we've made so many advances. As I mentioned earlier, injectables for PrEP. We have injectable medication for people who are HIV positive. 6 months now, we're looking at a year injectable to keep people virally suppressed. But the science behind that, and the research needs to continue, and that's also alarmingly, at risk right now. So the funds need to continue to come. They need to go to prevention. They need to go to treatment. They need to go to supportive services for people who are aging with HIV for all the reasons that we talked, in the beginning of the segment, the psychosocial. So there, I'll stop there, Roger, because I could probably take this question.
Well, let's make this our last question, because I don't think we've gotten into this yet. So this was an interesting one about, and we always at Nice so far are thinking about the caregiver angle as well, right? So if you are a caregiver, right, how do you start that? We just talked about the difficulty of talking about sexuality in general, but especially as a caregiver, it might be even more difficult. What are some of the things that they can do to start a conversation with an older person if they have concerns?
Yeah, that's a really great question. I was thinking about that a little bit recently. I was talking to a colleague about this. I think, because I'm a caregiver, for my older parents. They're 89 and 94, so at this point they're not exact. But I think you're a father, Roger, and I think when your children are old enough, you're going to have the conversation, hopefully, and I think as we get older and we become maybe caregivers for someone who we know might be sexually active, we got to reverse that, and we have to have that talk.
Right. It's the reverse talk.
A reverse talk. I think that's really, really important. And I think it's there's so many ways of bringing it up for people who might not be that comfortable, because sometimes older folks aren't comfortable talking about sexuality. So how do you bring it up? And I think there's ways to do that. There's ways to bring in the media, or hey, did you see this on TV, or did you see that TikTok? And I don't know how many people that are over 70 watching TikToks, but and you could or you can make jokes about things, and I think there's ways of bringing it up that might be less threatening. And I think and I think also as we just make a culture change, hopefully with the master plan of really getting some good campaigns out there, destigmatizing it, and also just getting some education out there to help folks have these conversations. But it's a great question. I think it's going to be a work in progress, but we got to continue to do it, even in the culture right now where sometimes things are getting a little bit harder to talk about. So we got to keep the conversations going.
On that note, this has been a wonderful conversation. I have a feeling it's one of many. I know we've worked together for a long time, but I could see us continuing this conversation in future programs and future interactions. So, John Hartigan, I want to thank you so much for being here on HIV and AIDS and Aging Awareness Day. There's your contact information, and I appreciate you being a part of the conversation. Thank you so much.
Thank you so much, Roger. It's been a pleasure.
So as always, I want to thank our communications team, Alex Hyatt and Darren Boyson, who are behind the scenes making this flawless and having all the graphics and all the information appear so professionally on screen. So thank you very much for your work. And our next program is actually on the 25th of September, where we're going to be talking with the team from the Virtual Senior Center. So please be on the lookout for that link on YouTube, and like and subscribe to our various channels, and look forward to talking to everyone again in the future. So have a good afternoon.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.